Sometimes we will need to induce labour. There can be a variety of reasons for this. It might be because of maternal reasons, or fetal reasons, or simply practical reasons. So for instance, if we have women who are developing preeclampsia, high blood pressure, who are diabetic, or have other medical problems, we might need to deliver them slightly earlier because we're concerned about the risks to the baby if the pregnancy continues for too long. And another factor which is becoming more common now is women having a baby over the age of 40. In these circumstances, we tend not to let the pregnancy go on quite so long, and we need to induce or perform a caesarean section earlier than the due date. If we're going to induce women, then what we want to do is to assess the cervix first and then plan exactly how we're going to induce them. There might be fetal problems. The baby might not be growing enough, or maybe it might be growing too big, and we're concerned that if we allow the pregnancy to continue, the baby will simply not fit. And in the background, we're always worrying about the low risk of stillbirth, which we know goes up as gestation increases beyond 39 weeks. So when it comes to the induction, what do? Well, we assess you beforehand. We assess the cervix. How favourable do things look that the labour is going to start easily? Is the head nicely down? Is the cervix nice and soft and thin and starting to open? If it's all of those things, then the labour should be fairly easy to start off, particularly if it's not the first time you've had a baby, and things can happen quite quickly. In these situations, we get women in the morning, give them some drugs, which can either be a tablet under the tongue or some gel in the vagina. We monitor them carefully for an hour, let them out of the hospital if they want to, and then get the labour proper started in the afternoon so that they have the baby in the early evening or before. In women who are having their first baby and we're inducing them, sometimes the cervix can be quite unfavourable and the head can still be high. In this situation, we need to ripen the cervix first. So then we get women in the night before, we give them prostaglandin pessary in the vagina. This helps to soften the cervix and also to prime the womb to oxytocin that's in their bloodstream, so that then when they do labour, they labour more effectively. This priming overnight normally means that women can sleep reasonably well, and then we can get going with the labour properly the following morning, and again, we will have the baby, hopefully, before midnight. During the course of the day, we might plan an epidural, we might break the waters, and we might need to use syntocinon or pitocin, as it's known in the USA. But again, these are all issues that will be discussed with you whilst you're in the labour, and joint decisions will be made. Sometimes in the private sector, we're inducing people simply because they live a long way away and are worried that they might go into labour and not be able to get to the hospital, and sometimes for practical reasons such as the fact their husband has to go on business trips, or they have family visiting from abroad and they need to know when the baby's going to come. We'll only do this if we think the cervix is favourable and if we think that it's the right thing to do. But certainly it's something we're prepared to discuss.